It is easily confused with the common cold, but it's much more than that. The CDC confirmed last week that there were at least 4 cases of the disease impacting children here in our state, with hundreds of other cases across the nation. For more on what this virus is, let's go to Gina, who is joined by Dr. David Kimberlin.
Doctor, thanks for being here.
Well, thank you for having me.
What is EV68?
EV68 is one of the members of the enterovirus family. Enteroviruses are a group of viruses that have been around forever. They usually cause summertime colds. They're prevalent in our part of the country somewhere between April or May through October, November. And usually, as I say, they cause just congestion, runny nose, maybe some fever, maybe some neurologic involvement as well in younger children. However, with this EV68, there seems to be a propensity, a likelihood that it settles deeper down into the chest and causes more respiratory illness.
So are we seeing more cases? Is that why we're getting so much attention to it?
Certainly other parts of the country are seeing a lot more cases of disease that has been linked to being EV68. Here in the Birmingham area, we are seeing an increased number of children coming in with breathing difficulty, with especially a lot of wheezing, and then shortness of breath, fast breathing, low oxygen levels in their blood, requiring some supportive care in the hospital for a period of time. We have not confirmed that those viral infections are caused by the EV68. We have confirmed many of them are enterovirus positive, but not specifically the EV68 positive cases yet in our area.
It seems like mostly children are getting this. Why?
Well, most likely, it's been a virus that's been around for 52 years and has caused outbreaks in the past. Maybe not quite as broad as this across the country, but certainly outbreaks in the past. So people that are grown up have probably seen this virus at some point in the past, whereas a young child has not. So they're getting it for the first time, and they're getting most likely more severe infections or complications or manifestations of it. The important thing, though, is that this is not a brand new virus. This is not something that a parent would never have had any experience with before. The parent is going to want to watch for the same sort of problems that they would watch for whether we had the nomenclature of EV68 or not. They're going to watch for a child to see whether they're eating and drinking well, whether they're breathing too fast, whether they can't get their breath and can't finish a sentence, whether they're having a lot of audible wheezing. Those are the kinds of things that a parent would be watching for anyway and seeking health care attention if they saw in their child.
So clearly, if your child has any of those symptoms, what should you do? Take them to the doctor or the ER?
Depends how bad it is. Certainly if there's a lot of problems, then going to the emergency room is the appropriate thing. The more likely scenario, though, is that they're seeing some things that are concerning to them, and I think calling the doctor's office and seeing what kind of guidance the doctor would have would be an appropriate thing to do.
Is this virus ever deadly, or is it just, it can be cured, obviously?
There's no specific antiviral medicine for it, but it's a viral infection that is relatively easy to support in a tertiary care hospital, a children's hospital like we have here in Birmingham at Children's of Alabama. On the other hand, when people are brought in and do get really sick, we've not yet seen in the country any documented cases of deaths from EV68.
And let's hope we don't. Doctor, thank you so much.
All right, thank you.